It's now my pleasure to introduce Caitlin McLean, who's the Senior Director at the Milken Institute. And Caitlin will lead us through a compelling presentation on scalable financing models for LGBTQ plus affirming affordable housing. Following Caitlin's talk, we will open up the floor again for some Q&A with Caitlin, and then we'll have our closing remarks by Priscilla Coe with the Harry and Jeanette Weinberg Foundation. Caitlin, take it away.
All right. Thank you, Cheryl. Thank you for having us. Thank you for the collaboration that we've been working on with you guys. Thanks to Michael as well for his leadership. And as Cheryl just said, to Vinny and then the panel, Dr. Amani Sisi and Gretchen, the panel, the amazing inspiration, but the amazing hard work that's happening. And now it's 3:30 in the afternoon for those of us on the East Coast, and I get to talk to you about funding. So I really hope that you got more coffee than Cheryl did, and you stay awake for what I'm about to talk to you about. So thank you again for everyone sticking around, for joining us. I also do want to say thank you to the ASL interpreters. My mother's a sign language interpreter, so I'm going to apologize to them in advance that I talk very fast. And so it'll be a pain for you to sign, but good luck. So we, the Milken Institute, we're a financial and economic think tank, and we have been partnered with SAGE very proudly to work on trying to design more sustainable funding models for LGBTQ plus affirming and welcoming housing. And what that means is really helping to design and market test new models. These models might not be necessarily brand new in terms of affordable housing, but maybe they're new to this type of development or for this age group or income bracket. There's a wide variety of options in terms of funding. And fortunately and unfortunately, it often takes quite a bit of outreach to a wide variety of funding sources to get these developments up and running and maintained for the long term. And so what I'm going to talk through today is just some of the kind of key recommendations and examples that came out of a series of interviews that we did with market stakeholders, including many of the folks on this webinar. So Maddie, if you don't mind going to the next slide, please. I think we've all heard today about, some of the challenges in terms of providing really truly affordable housing options for LGBTQ plus older adults, given some of the challenges financially that the community faces in terms of, kind of retirement savings, in terms of, kind of the demographics of more often than not living alone, or, kind of facing discrimination, or, kind of living below the poverty line. So there are a whole host of challenges, which I think most folks here are very aware of. And we bring this up mostly to say that part of what we wanted to do with this project is to hopefully build a supply of housing that can not be overly burdensome financially to the community. And that means either having more accessible funding or hopefully also lowering the costs of the actual development and operation and maintenance of the housing itself. And so certainly you just heard some of that from the panel before this about obviously how they kind of have to cobble together different funding sources, but also how they have to be very creative with their partnerships to help lower some of the costs, the significant costs that there are associated with especially housing for older adults, even if it's independent living, let alone assisted living. So just to say, very aware that all of these models need to be very thoughtful and grounded in the fact that the housing needs to be affordable for the community. Maddie, you can go to the next slide, please. Again, we've heard a bit about the kind of dynamics of the market, which is exciting in terms of more units across the United States and kind of more demand, as we heard from the panelists, kind of more interest from the community. It takes some time to get the awareness out there, but then once there is the interest from the community, unfortunately, we still need so much more. And the pace of development, generally speaking, for housing is slow. There is a whole host of challenges in terms of bureaucratic kind of red tape. And so, there's efforts that we need to do now and things that we need to get funded now, but there's also what we need to think about funding over the long term, because these projects take a long time. And as more and more of us age, we will, you'll see more and more folks needing access to affordable housing. So, when we were talking to the variety of stakeholders that we interviewed, and Maddie, if you can go to the next slide, we interviewed over 50 different market stakeholders. And they talked about some of those funding challenges, some of the things that that folks look for when they are trying to select kind of where they want to live, as we just talked about, kind of aging in place and wanting to live in a community where they are respected and they are safe and they are loved. And so I think that there is these solutions that I'm going to talk about hopefully encompass a lot of that response from, as I said, the interviews that we did largely from folks in this on this webinar. So if we go to the next slide, Maddie. These are going to be kind of the main challenges that we heard, and I think we just heard a lot of them, so I'll talk through them pretty quickly, but we just heard quite a few of them kind of teased out during the panel, and what Vinny mentioned as well in the opening keynote. The challenge of the specific design elements, and I think someone in the chat mentioned or referenced kind of bespoke development, and the challenges that brings with it, because it's not sort of a cookie cutter. We're putting exactly the same design elements in place, and we can replicate this at a scale of thousands of units at a time, because there needs to be kind of more centering on the community and the community's needs, and that looks different. As to Gretchen's point, that looks different kind of geographically, as well as just each human to human. So really thinking about kind of what those design components are and the additional costs associated with those. The challenge in terms of having fewer incentives for developers to actually use kind of a standard playbook. We were just talking a lot about kind of why isn't there a more standardized playbook alongside what Sage actually offers, which are amazing toolkits. And so, what are the incentives for developers to use those to include at least some design features or programmatic features that are LGBTQ plus affirming? The other challenge that we heard about in the panel is, kind of this idea of how do you market to developers to want to do this, and that some of the challenges there include an absence of data to really quantify kind of the health impact and kind of financial impact of the services and of the housing. I think Cece mentioned, the investment in this type of affordable housing development really is very additive to the community. But oftentimes the next question is, can you define how that is additive to the community? And there is some data, but again, kind of going to the bespoke comment, there might not be kind of a big enough sample size of developments just yet to show kind of systematically the economic impact and the health impact and the social impact of these communities, of which we all know it's true. It's just that oftentimes developers and investors and donors will ask for those metrics, which can be challenging. And so then all of that kind of market dynamic then leads to the challenges in the financing, which are the added costs. Added costs in the design features, added cost in the actual kind of development itself in terms of purchasing the land. We heard examples of cities, of urban development previously. Obviously, those prices are significant. Not to say that rural and suburban areas don't also face large land costs, but certainly there are discrepancies between and disparities between the pricing of kind of developments depending on where you are. All of it's a lot, though. And so needing to then integrate multiple funding streams That could be public sector support. We've heard about the LIHTC, the tax credit at a federal level, but also certainly cities and states, thankfully now, because of the federal programs getting cut, cities and states often have their own programs, which I'll talk a little bit about, but kind of cobbling together all of those sources is historically challenging. And that leads to, kind of how do you really build out a kind of cohort of, kind of capital providers. So are there different lenders you can go to? Are there different, kind of managers, asset managers you could go to? Are there developers you could go to? And there aren't necessarily, kind of that group. And so you do have to kind of go and find them on your own. And so again, we'll talk a little bit about some of the recommendations to try to make that a little bit easier. And then finally, the policy challenges, which again have been highlighted already in terms of the uncertainty at the federal level, and the challenges that Gretchen mentioned in terms of using area median income, AMI, as the kind of gold standard for how we judge, kind of what is really affordable for a community, and the challenge that brings for seniors, especially seniors, older adults who are living purely on Social Security, or some type of supplemented Social Security. Even then, the challenge of being kind of in that income bracket and being able to even afford affordable housing, quote unquote affordable housing, even with a voucher or any sort of assistance, is still challenging. So with all of that, hopefully we'll leave the depressing parts of it and now go to some solutions. So Maddie, if you don't mind going to the next slide. So here is what came out of the interviews and the consultation process that we did with all of the industry stakeholders, is, kind of this list of recommendations, which will hopefully address many of the challenges that I just mentioned. Now, I'll just caveat all of this to say, again, funding is hard. The current, kind of government challenges are not insignificant. That includes, the actual cutting of funding programs, but also the challenges in, kind of headline risk or perceived headline risk, and any uncertainty in terms of just the kind of political nature of developing LGBTQ plus affirming housing. And so this is not to say that any of these are easy. And I know many folks on the webinar have tried certain things. And so this is not to say that each one of these is the exact answer or panacea. It really will take a menu of options. And it will take, kind of, as I said, kind of piecing together all potential sources as much as humanly possible. So I'm going to go through very quickly each of these so that hopefully you get a bit of an understanding, and then we can go into the Q&A and maybe dive in a bit deeper to some of the models that resonate most with the folks on the webinar. But the first is something that I think was brought up very early on about kind of how do states or cities, municipalities, even kind of smaller municipalities, how can we help to advocate for more funding? And so one of the ways that we are hoping to push different cities and states is through issuing more social bonds. So social bonds are just like traditional municipal bonds, but they have a social label on them. And why is that important? Because there are a wide variety of investors. So those could be pension funds, sovereign wealth funds, a family office of a high net worth individual, an endowment from a hospital or a foundation, who want to see some of their funding going towards things that have a social impact and a financial return. And a social bond is a very easy way to tap into that. So we'll go into all of these. I'm just going to quickly summarize them. So a social bond is a way to engage kind of the public sector for more funding, an impact investing fund to go through to attract kind of potentially some of those investors who do have more of a kind of socially minded lens to their investing strategy. We'll go through what is called a social impact bond or probably more accurately called a pay for performance contract. And then also talk a little bit about some of the, potential best in class prize, especially around some of the design elements and how to make some of those design elements less bespoke to go back to the earlier comment. And then finally talk through some of the ways that there could be partnerships either with the financial services world, so developers or investors, but also, kind of potential industry partners. I think Cece might have been mentioning some of the ways that they were engaging the local community, employers, retail, kind of the small businesses in the community. And so thinking through that. So that's a lot. We'll go through kind of one by one very quickly. So Maddie, if we can go to the next slide. So the first one, as I mentioned, is a social bond. And I think that this is, we have had some conversations with a few state treasurers and different municipal CFOs, chief financial officers, to talk about whether or not they would be interested in issuing a social bond, which is paid back through revenue from the state, tax revenue, and from their budget, but geared towards supportive services for housing. And so this is not to assume that it would be entirely LGBTQ plus focused. The scope and kind of scale of a bond needs to be fairly large if it's a municipal bond. And so the idea here is to say, could a state, given what's going on at the federal level, issue some social bonds that do enable more supportive services and affirming services for older adults. And it can be positioned that way as, supportive services for older adults, and have a carve out for LGBTQ plus affirming services within housing. So that would be the ideal. Certainly, the biggest champion needed there obviously is a city or a state issuer, the issuer of the bond. And so those are conversations that we are having alongside SAGE to try to encourage more and more states to focus on, especially the services portion of the funding. Not to say it's not hard to also get the funding to build the actual housing itself, but sometimes the ongoing maintenance, operation services, and the preservation of the affordability of the housing is actually a large portion of the cost, and some of the most challenging to fund. And so thinking about kind of using this model to support that. So Maddie, if we can go to the next slide, this is just a case study of what that looks like. As I said, there are states that have issued these types of bonds before. Oftentimes they have a specific focus area. So it's, again, not to say that it couldn't be as narrow or as broad as we would recommend, but this is all to say it is possible, and it has happened before, and it is a decent amount of money. In this case, it was for developing supportive housing to address homelessness in California. And so, just thinking about kind of, is there a way for the LGBTQ plus community of affirming housing developers to kind of come together and think about what they would like to see in terms of a bond issuance, and if we can help to put something like that together. So we can go to the next slide, Maddie. So the next piece of it is, so that's a bond, which I just talked about, which would be kind of big scale funding and financing, hopefully, kind of accessible for a wide variety of developers or owner operators of housing and supportive services. But that does take quite a bit of political will from a state or a municipal issuer. So the next option is that we recommended is to design an impact investing fund for more inclusive and affordable living environments. And these types of funds exist already. Many of you have probably worked with them in the past. And so there isn't necessarily just one fund that is specifically for housing for older adults, let alone housing for that is LGBTQ plus affirming. And so, could we, is there enough investment demand to and investment opportunities to design something that is more about inclusive and affordable housing, and affirming housing, as opposed to just traditional affordable housing. And what this type of fund does is marry basically capital that is not looking for traditional returns, would be what they call concessionary, looking for funding that or investment opportunities that don't necessarily design or are not designed to compete with kind of market rate returns alongside commercial capital. And so it can kind of blend the investment kind of continuum, whereby some investors are willing to take less returns so that the other investors can get paid back what they would normally want to see. And therefore, the funding itself can be used, the investment itself can be used for projects that maybe don't generate traditional market rate returns. So even in affordable housing, if you're saying, hey, I don't even compete with the affordable housing, kind of development down the street because of the services that I need to provide, or because of some of the challenges in terms of the building that I'm buying, or whatever it looks like, then this type of fund would be beneficial, because they aren't looking to just make the most amount of money necessarily. There are investors in the fund who are willing to take a bit less return, and so that makes it a little bit more attractive for everybody. And so, if Maddie, you can go to the next slide. There are case studies of funds that exist already. Some of those are a mix of kind of a public-private partnership. I think the panel talked a little bit about this in terms of, kind of who invests in these types of funds. And happy to also talk about, kind of funds that folks on this, kind of webinar could go to. If you're not familiar with the folks like Turner Impact, there are large institutional investors like PGIM, which is Prudential's investment arm, which has an affordable housing fund. We mentioned this case study that we use, kind of the Healthy Neighborhoods Fund, all of which would be focused more generally on affordable housing, but I think would be, kind of options for folks who are looking to take on equity investment into their project if they need access to equity for the development of their project, but don't want to, kind of have a cost of capital that is so high. There's a little bit more flexibility with these funds. So I talked about a bond, which is a little bit more on the debt side. Obviously, this is a bit more of an equity component of how you're putting your capital structure together. The next piece, Maddie, if we can go to the next slide, is a bit more about kind of how do you capture the value of the work that you're doing. As I said, piggybacking off of what the panel was talking about, the impact that developments have on the community and the improvement to the community that these developments bring. And so how do you capture that? Especially when I think Gretchen mentioned, there's not necessarily a revenue model attached to it to say we're providing these amazing services. It is making people healthier, happier, kind of more financially secure, at least in, kind of their ability to live where they can live and pay for it. And so how do you capture that in a model? And so this is an example of that. The term of art is social impact bond. It's not really a bond. It's basically a pay for performance contract, which means that there are some upfront investors who will invest capital, basically be a part of the contract to allow for certain social services, including providing supporting services in a housing development. And then if they see demonstrable, positive impact. So for example, if we're saying these social services have an improved, kind of overall effect on the residents of the housing, because housing is also healthcare. If that type of housing and the services provided improve mental health, if they improve overall access to healthcare, including, kind of if you need additional checkups, if you need, a bus ride, if you need, just better access, if you are lowering the amount of times that somebody has to go to the hospital, even if it's not assisted living, even independent living, right? There are challenges with older adults in terms of falling and things like that. So, there's a wide variety of improvements in health that could be quantified. And so basically, this type of model would say, great, we can't entirely financially project that, but we can understand kind of what that impact could be. And so there would be an outcome payer, which is either a foundation of philanthropy or a government agency, who will see some type of cost savings or will appreciate the cost savings and the overall benefit to something like the health of the residents, and therefore pay back the original investors. So the original investors put the money in to support the services, and then when there is a social outcome, then the government or the philanthropy pays back the investors. It's not a huge return that they're making necessarily. These are usually socially minded investors, but it does increase the pool of potential investors who might not otherwise invest in social services because they don't see revenue generation. And so this is a way to capture that, especially because of the amount of amazing follow-on impact that LGBTQ plus affirming housing services in particular have for older adults, especially around things like social isolation, on some of the kind of day-to-day health challenges, even if it's not something where somebody has 3 or more ADLs. It's really, kind of thinking about the people who have just kind of chronic illness, which most of us will have as we age, then really thinking about kind of the benefit that this housing provides. So if we can go to the next, I'll just give a little case study. This is about kind of, again, the health impact tied to a specific intervention, in this case, looking at adults that were at risk for type 2 diabetes, and lowering the, kind of overall health costs associated with that. And so in this case, this was in Sweden, but it was with a commercial investor, with a life insurer and a commercial bank, who understood that, kind of thinking about prevention and kind of early detection of programs that will eliminate folks from having to go into the hospital and seek care for diabetes would be beneficial for them financially. So they were willing to put together this contract. And I flagged this, it's a somewhat wonky model for sure, but I put that in there because I think some folks were talking about in the chat, what are ways to engage some new potential investors or new sources of capital? And so I would encourage folks to think about health systems, hospital systems, insurers. They haven't always been the best friends to housing developers and affordable housing developers or service providers, but I think more and more they are understanding that housing is healthcare, and that they can potentially partner. So you will see hospital systems, and you will see healthcare providers, payers, who are investing in affordable housing, using their own budget to invest in affordable housing, but also using their foundations to provide grants, especially for supportive services. And so just to think about, that might seem somewhat outside the box. Even I think someone in the chat was talking about some of the challenges in terms of COPD, other lung-related issues that the community might face, and some of the challenges in terms of things like sharing, kind of laundry facility. That is something where there could be a way to engage different philanthropic organizations that are more specifically about health, about those healthcare conditions, or engaging with payers and with insurers and hospital systems to try to think, kind of creatively about how to fund some of those design elements that would be more specific for the community, to where they might not, that might not be a normal thing that they fund, but if it's positioned in that way, I think it could be an interesting opportunity to engage them. So that is a, kind of social contract. That's really about kind of how do you monetize the benefit of LGBTQ plus affirming housing, where there isn't necessarily a financial kind of revenue being generated. If we can go to the next slide, Maddie. If you don't mind, the next slide is really looking at some of those specific design elements that I was just talking about in terms of the kind of things like kind of shared spaces and shared resources, and what variations and design that needs to have to be centered in kind of community need. And so this is really about, coming up with a prize. So a prize competition. These prizes exist for a wide variety of social, kind of challenges that we have, whether it's climate, whether it's housing, it's water, it's education. There are a wide variety of prizes. The X Prize is probably the most famous, but there are a wide variety of prizes. There are prizes on cancer research. And so it's not a new model necessarily, but the idea is, if there are potential, kind of partners that we could engage that would help to support the innovation needed to help those design elements. So even just focusing on what I was just talking about in terms of that shared resource with the laundry facilities. And so if we're saying, could we go to some of the large industry players, the tech players, or the commercial goods and consumer goods players, and say, can we partner with you to, and your foundation could give us some funding to launch a prize to say, like, what is the right design element if that doesn't exist right now, or what is the new innovation that we need to make this more accessible for the community, especially for a community that is more predisposed to have challenges in terms of breathing or lung issues. And so saying, can we frame it in that way where potentially, because they like prizes, right? It's kind of cool to say we're coming up with a prize and we're funding innovation. Could that be a way to attract some potential funders or donors who are interested in that innovation piece, so that there are more opportunities for developers to have access to those types of bespoke innovations, but have them at a better scale. So as I mentioned, Matt, if you don't mind going to the next slide, these exist. CMS itself has had an innovation award in terms of funding kind of innovations that lower costs and improve care. This was CMS, CMMI kind of innovation play. And so they were decent sized awards. And so this would really be for some of those architectural firms or tech companies, or, kind of an opportunity for potential partnerships, again, maybe a little bit outside the box of who you would normally go to say, can we think about either care delivery, tech-enabled care delivery? Is it a way to think about design elements and kind of layout, and which materials we use and what materials we don't use? And it could also be climate friendly awards. So is there a way to have tap into funding that is more about housing developments that also have environmentally friendly LEED standard, kind of energy cost savings, solar, wind, et cetera, kind of different technologies that can also unlock additional funding. So the prize competition is pretty flexible. It's just a way to think about engaging different types of investors. So that leads me to the final, hopefully you're still awake, the final recommendation, which is also about trying to engage investors or donors who are the usual suspects. And so this is really about the financial sector in particular, and partially that's because we're a financial think tank, and so we work most closely with the financial services world. But a lot of these folks, these organizations, make investments into housing, into real estate. They often have large real estate portfolios. They often also have senior housing or housing for older adults as part of their housing portfolio. And many of them also have or had, unfortunately, affinity groups, and largely have groups that were maybe called DEI or maybe actually specifically LGBTQ plus affinity groups. And could there be a way to engage them in a bit more of a creative way, either through their volunteerism? I think somebody was talking in the chat about how do you get care and services. Are there programs that could be kind of uh, sourced through potential partnerships with different kind of affinity groups? It's again very difficult to do. Not saying this is easy, but kind of are there ways to think about the investors in your city, in your neighborhood, in your community, in your state, large employers, large corporates? Are there people who have a large footprint financially in your state, in your local community, city, town, whatever it may be? And is there a way to engage them either with their staff and their staff time, but also potentially through a kind of creative investment structure? And so that's what I'm going to talk about finally, which is a case study. Maddie, if you don't mind going to the next case study, which is Ares, which is a financial services firm, has a fund called Pathfinder, which is where they take basically a portion of their kind of carried interest, their profits, into a fund that gives that funding philanthropically. And so there is kind of a charitable tie-in basically to the money that they make from this fund. So it allows them to attract investors who say, great, I'm going to make a lot of money, but you're going to donate some of the, kind of profits that you would receive to charity. So that makes me want to invest even more. So it's a win for them because they're getting new investors. And then they donate the funds philanthropically to particular interest areas that they have. So in this case, it's Ares. They have specific kind of interest areas. And so our thought was, could we work with some of the investors, real estate developers, kind of some of the big firms, again, employers, industry, who care about the community because they're based there, wherever there is for you, and then see if they might be willing to look at a similar type of structure. Again, it's not purely philanthropic. It is attracting investors to that fund or to that organization because they are making money, but also donating some of the portion of the profits to charitable organizations, which in this case would be ideally LGBTQ plus affirming service providers. So these are all of the models. That was a lot to throw at you, but just kind of recap. I think what we would love to see is, kind of how we can help in terms of collaborations given the challenges in the federal funding, and given kind of the current political landscape, which is very challenging. There needs to be more private sector engagement. And if these models can help engage the private sector where maybe they wouldn't before because they thought the public sector had it and the public sector doesn't have it. And so, if we can help engage the private sector in a new way, that's what we would love to do with folks along the Zoom. So, Cheryl, I think I'll pause there, and just, would love any Q&A, any questions, any thoughts folks have.
Yeah, thank you so much, Caitlin. And I'm actually going to ask our panelists and Vinny if they would like to join us and just kind of engage in a conversation with you based on, what they've experienced firsthand with fundraising and filling the gaps, and how this presentation resonates with them and other questions that they may have. And then we'll also bring in some questions from the audience. So this is an audible. We didn't prepare for it, but thank you all for playing along. So Gretchen, Cece, and Vinny, any thoughts?
Well, there a couple of them are at a disadvantage because we use their brain power to come up with these recommendations, Vinny, Gretchen. So so a little bit unfair that I would probably call on them first just because they've already had to brainstorm with me before. But I don't know, Gretchen, maybe just from what you were talking about in terms of some of the philanthropic funding and the ways to kind of kind of provide long-term support for the for the services, I think. Have you seen, maybe just curious your thoughts about kind of engaging some of those maybe corporate or other large kind of industry players in and around Boston, in a kind of more unique way maybe to what they normally would do?
Yeah, we had really good success, and thank you, Caitlin, for this, and thanks, Cheryl, for bringing us all back on. This is a terrific conversation. So, we had great luck with corporations and foundations very early on. So the Liberty Mutual Foundation, funded our fitness room, all the equipment there, and also gave us a grant to hire a community engagement coordinator, a full-time person to do outreach, and gave us a grant to finish the apartments because it's a City of Boston requirement. We have 8 units that are set aside for people exiting homelessness. So we didn't want any of those people to have to sleep on the floor until they could afford to buy a bed or a chair. We actually got a Liberty Mutual fund to provide basic furnishings in all of those apartments. So we tried to be very creative and thoughtful. And when we were looking for, so it's always easy to get funding for a specific program. So Liberty Mutual was very happy to give us those grants. Eastern Bank Foundation did as well. The Weinberg Foundation was enormously generous. But it's very hard to get unencumbered money just for programs and services. And it's very hard to explain why we're doing programs and services in an independent living senior building. So I think at the model, we still have a lot of education to do, and a lot, and you pointed this out. There's so much like money saving and community building, and just this investment in allowing and making it possible for our older adults to stay in community and be functioning and have, a few dollars in their pockets is enormous in terms of strengthening communities, and has enormous return value. But it's taking a little bit to figure that all out. So I don't know the answer to that. And I do know, however, that in Boston, we have had so many employee resource groups from real estate and finance and banking and law call us up and want to do a project, but we're a brand new building, so we don't have a room for them to paint, or a garden for them to to plant, or things like that. And we don't have a person to coordinate volunteer services yet. So there's a lot that as a new building, you don't kind of fit into the categories of what employee resource groups are thinking of doing. And every time I tried to talk with a coordinator about, like, well, why don't you guys do a fundraiser? That was the last time they ever called. So so I think
Exactly. Write a check. What? I don't hear you. Where are you? Where'd you go?
But so I think there's just a lot of, and thank you again, Casey, for keeping up with me. I talk so fast, but I think there's a lot of education we need to do, and a lot of, we all carry these stereotypes about who older people are and what senior communities are, and that is so wrong. Those things are not correct any longer. And Vinny, you're shaking your head. Yes, I know. I can tell from everything that you said that you totally agree. I mean, we have resident-led programs, a resident-led drop-in group for people with addictions, a resident-led death cafe. I mean, people are doing amazing things, and just in their 60s and 70s and 80s. And so that's what a senior community feels like now. And but like sort of getting that into the common imagination so people can be imaginative about how they support this, I think, is a real challenge. And I don't know if I answered your question, but I think it's an ongoing
Yeah, no,
challenge.
exactly. No, but I think that's exactly, I mean, it's helpful, I'm sure, for the audience to hear those types of examples. I think it's also, it goes to, why we were focusing on some of the models that would have kind of bigger check size, kind of
Right.
programs, because it's not just then we're refurnishing something, although those are important too, like small program checks are important too. But I think we were mentioning land trusts, earlier as well, is there an opportunity to partner with existing land trusts or land banks, of which there are many? Most states and cities have them. And so, is there a way to partner so that there is, some type of carve out or some type of access to, kind of large property or kind of opportunities for property for LGBTQ plus affirming housing? I don't know, Vinny, if you've thought about, you mentioned a bit in terms of the San Francisco example and having leaders, executives at these entities that are supportive, but, curious if there's a way you've seen where maybe more, kind of service providers or housing developers can actually partner, kind of more specifically with some of these kind of bigger entities, bigger platform entities that have bigger dollars.
Yeah, thank you so much. And I'm gonna bite off just a small portion of that question here, and just say, trust the wisdom in your community. A lot of people are just beginning to do planning around right of attorney, estate planning. So many LGBTQ plus and two-spirit individuals who are aging have never been given the tools to do their own end-of-life planning. And there's a lot of opportunity here to connect our community members across generations to people who are actively involved in the legal work of estate planning to help problem solve within their own social circles. And so you find community members creating pods and moving in together within walking distance of each other to create mini campuses near larger campuses like the open house campus. Think beyond who might impact from your supportive services. It's more than just the residents. At open house, our campus houses 140 community members, but we serve over 3,600 unique individuals a year. And so the investment in these campuses, these physical structures, aren't just about housing people on the site of the campus, but they're about normalizing what it means to plan for each other's well-being. And that is worth investing in because we know that there's a huge transfer of wisdom and also a huge transfer of wealth happening right now in LGBTQ older adults who do have assets but don't have cash. And there are a lot of conversations here where those of us that are fortunate to have access to resources know our responsibility to distribute that to others who have been dispossessed or marginalized because of larger structural forces that have harmed them, discriminated against them, people by no choice of their own that have lost or estranged close family members or loved ones who don't have kids to help them. We are the sandwich generation. So when we talk about the community of older adults that we want to age in place, we also have to talk about the community of caregivers and care providers who do friendly visits. At Open House, we have hundreds of volunteers as young as 21 making phone calls to community members. And this is where we can help distribute and decentralize the problem solving. And this is really exciting for ERG groups and individuals who work in life insurance executives, housing developers who are both for-profit and nonprofit, and policymakers, because we all can help to solve this for this moment. And as I said earlier, every day is a moment in our movement, and this movement is not going backwards. So.
Yeah, amen to that. Yeah, I think that piece that you mentioned in terms of, kind of the ancillary, but not even ancillary, but the benefits that a development kind of brings and the services bring to the community, not just within the walls of the development, I think is very important, again, in terms of the pitch to potential investors. It also goes to, is there, kind of, I think one of the early questions was about kind of pools of funding for folks who are trying to kind of self-aggregate, right? And kind of come together and think about development. And New York and California both have like ADU funding, kind of for smaller units. There is kind of public sector funding for some of that, but it's interesting to think about kind of tying that to the benefit of the services that an actual community brings. I know some folks like United Church Homes and some other older adult housing providers also have kind of outside the house kind of programming and services. So it'd be interesting to think about kind of for others how that works. I know there's a question, Cheryl, in the Q&A about the Roth IRAs. I mean, what all of us should be doing with our retirement funds, basically, if we're lucky enough to have some type of retirement fund, like how we are directing that to be invested. Like we should all be more proactive. The challenge is that even if we wanted to be proactive, sometimes we don't necessarily have the options within our managers, the people who are custodians of our money and manage our money, to make investments that will actually get to what this question is talking about in terms of, funding the building, funding the, kind of land and development versus funding the services. And so that's where this idea of a bond, a social bond, or an impact investing fund, those are specific products through which you could channel your money, right? Because at the end of the day, if you're calling up a manager or if you're thinking about kind of anything that's self-directed in terms of your own capital, kind of where do you actually park that money so that it gets to a place that you want it to get? So you actually need, kind of the financial models, which don't necessarily specifically right now have necessarily a direct channel to CC or Dr. Amani or Gretchen, right? Like they don't, or open house, like they just, so it's how do you get that capital? So I think that's why some of the models that we were recommending with Sage would capture some of that capital, if that answers that question. But I don't know, Cheryl, if there are other questions from the chat you wanted us to tackle.
Yeah, we have another question regarding equity and fair housing. And CC, this is related back to your talk, where you talked about revising the tenant screening standards, having a robust grievance process, and how we de-escalate disputes between tenants, and just wanted to know if you have thoughts around that.
And I see that the questioner is asking if I can share these resources. I certainly can. I don't.
Okay.
We have some of them. I don't think we have all of them, but the application process and the grievance process if denied. And so, Cheryl, is that something I should send to you? And you can
Yeah, we can actually help coordinate that, on the back end. And
sure, I will share what we have. And I'm an attorney, so I don't mind reading really long, tedious documents, but you might want to have some caffeine when you take a look at it because it's pretty long. Yes.
Thank you for that, Susie.
Just to jump back super quickly to the previous thread, is one potential source of funding that might be available to you, and it was to us, was Dallas has an Office of Economic Development. So that office is charged with bringing capital into the market of Dallas and then distributing it back out, basically. And we think about the literal words of economic development. They want funds to help improve neighborhoods. So to Vinny's point, it's not, what we're doing is not just creating housing for the residents of the facility, but what other impact it can have in a neighborhood. So we were able to get tax increment financing directed through, or the access point to it was through our Office of Economic Development. And then a couple of other things that just popped into my head really quickly are that a way to engage individuals who want to volunteer or provide other types of resources, from whether they are ERG groups or community groups, but is there an opportunity to provide meals in the space? We have a large community room, and food is a giant attractor for all of us, a good way to create community. So that's a way by which we can engage some non-resident groups. And then our resident services coordinator, created a food pantry within the facility that's just for the residents, but food drives are something that our community has been used to doing for decades. And so volunteers can help contribute to stock the pantry as well. That's been useful to us. And then last but not least, this is something that requires some thought and finessing, but we actually will from time to time offer tours of the facility. And the reason I said it requires some finessing is because this is a home for the residents that so I wouldn't want a group of people traipsing through my individual house. So we are mindful about that in not wanting to disturb the sanctity of people's homes, but yet there are some more communal spaces and the property is very attractive and there's some really neat art and affirming art in the building. So we will show that to folks from time to time. And then we created a consolidated health services across the street as part of our expansion of our programs recently. So oftentimes we'll combine those two things. We'll show someone the more public areas of Oakland Place, and then we'll walk across the street and show folks the health campus. So I think there's a respectful, mindful way to do that. But my point in bringing it up is it's so tangible. And when you have something for either interested community members or donors to look at, it's not easy to do these projects in whatever iteration they are. And I think it lends credibility to our organizations that we have created these. And it can be a leverage point so that others understand the sophistication of our organizations and the accomplishments that we've made and the things that we're contributing, not just to our own community, but to our overall like giant metropolitan communities who all need more housing. So we have had those conversations and try to keep that mindset as well.
Dr. Amani, jump on in. No need to
Okay.
raise that hand.
Caitlin, thanks for your presentation. I just love this report. We made a little video about it. So we just love the information that we received on this. I'm going to the next question, Cheryl, if that's okay.
Yeah, go ahead.
Yeah. All right. So one of the ways we raised money was we sold bricks for the stone wall. We sold bricks for the stone wall, and we sold bricks for the yellow brick road, because back in the day, Are You Friends of Dorothy was a code for are you gay, or, are you queer? And so we did that. And we also, and someone else talked about this, but we have a wall of a groundbreakers wall that's colorful triangles of rainbow colors with your name that we sold for $1,000 and $1,000 and $1,500. Small amount, but lots of people wanted their name up there. And we got the mayor's name is there, and city council often, there's I don't know what to call this, but getting all the nurses to buy a wall, to have a competition to do that kind of thing. So we kind of did that and it helped to complete some of the gaps. So there's that. And I wondered, Mary's House, Goldman Sachs was one of its investors, and they came to us because our developer was in a program called the 1 Million Black Women Initiative. And so we thank goodness, and that helped us out a whole lot, even though now, in this environment, I think it's still going on, but they've kind of scrubbed the word Black out of it or something. Yeah.
No, I mean, that just goes to number one, like fortunately you are resourceful, but like the unfortunate need to be so resourceful, right? In terms of kind of tackling different ways to attract donors. I mean, I work for a very large philanthropist, and yes, of course, like putting your name on something, they love putting their names on things. But I think not even just kind of like large donors. I mean, I think to Dr. Amani's point, like even some of the smaller donors, like $1,000, would be a lot for me, but like for some people, it's not a lot of money. And so I think, you know, engaging more of those folks, and not just thinking about it as like the billionaires, to try to attract, is pretty important. I don't know, Gretchen, if you also were able to engage some of the more individual community. Yeah.
Yes, we definitely did. We had an early angel who still is anonymous, who was very, very generous. And we have individual donors. We named our elevators are all named in honor of donors. Our LGBTQ senior housing offices is named in honor of our co-founder Eileen Montour. So we have done those things as well. And we're about to have our first director of development. So when you have a small team and you're doing everything and building a building, it's really hard to also do fundraising on top of that. But we raised almost over $500,000 we contributed to the capital fund of the building. And now it's about sustaining our team so that we can provide the programs and services at the Pride while we begin to develop our next project and find our next project too. So there are a lot of challenges to do that in this environment. But yes, we're always looking for ways to bring in the dollars that will sustain operations, which again is the challenge. And as everyone here and on this call knows.
Someone's asking how much the bricks were. They range from, you can get a brick for $100, you can get a brick for $500, and a brick for $1,000, and they were different colors. The yellow brick road brick, I think, was $1,000, and the regular brick out front was like $100.
And can I just say that as soon as the government shutdown affected SNAP, and so people's SNAP benefits disappeared, the brand new local lesbian queer bar reached out to us and said they wanted to do a food drive for us and name a drink on their menu that would be ours in perpetuity, and we would be getting the profits from that drink. And they asked us to help name the drink, and the drink is going to be named A Friend of Dorothy. So
How cool is that?
we're very lucky here in Boston. So,
Amazing. Yeah.
but I have to say, my younger team members weren't familiar with that phrase, so us old folks had to like say why that was important and a nice thing
Yes.
to do.
Deliver the history or her story. Yeah.
Right.
I think I would just say, just, and I know, conscious of time, Cheryl, and where we're going with the Weinberg Foundation. I mean, I think it's great to think about, are there ways to kind of attract the individual philanthropist or donor at various levels, as Dr. Armani just mentioned, but then also thinking about how to engage philanthropy in a way to get at what Gretchen is talking about, like that long-term capital that you need. And so there are foundations. I mean, Weinberg does amazing work, but you know, Ford Foundation, Kresge, MacArthur, like other foundations that give grants to help provide kind of long-term capital, like credit enhancements or a loan guarantee, or different types of low-cost, you know, kind of debt capital. And so thinking about, you know, if we can kind of consolidate some of these large donors who maybe can provide into a pool, that pool then, you know, kind of can be self-generating, so that it's not always having to go back to the same donors to ask for the $1,000. Like, can we do that and also get some of these larger checks? I think that would be a great strategy kind of moving forward.
That's an amazing idea, Caitlin, and would love to continue to work with some of these ideas that we've heard here today and that you all have talked about. You know, as we go into the final stretch, we have you all here on screen. And so I would really just love to go around the room and, you know, what's resonated with you? What's your takeaway as you listen to each other talk, as you know, heard what Caitlin was saying today? Is there something that really stood out to you about how we continue to move this work forward, especially in the present moment? Cece, I know you have to jump off here in a minute, so why don't we start with you, and then we'll just popcorn it around the room here.
Well, I've been very moved by many of the comments today, and with Michael leaving, that felt even more poignant. But I always appreciate a historical context, And then Vinny continued that as well. And Vinny, I haven't had the pleasure of meeting you in the past, but thank you so much. I really have appreciated your perspectives and presentation. The reminder of how much our communities have been through and overcome, as well as persevered through. And basically, you can't keep us down no matter what. Not to minimize the current day challenges that feel different than many other times, but nonetheless, we are creating these things. I mean, resource centers in Texas, and we had not one opposition to what we were doing. It was the least political process, other than the fact that the tax credits are just so uber competitive. I mean, I was really shocked. There was no advantage to being a queer organization. You know, sometimes that if a funder or others are interested in assisting our cause, that would be an advantage for their interest. But this was a neutral project in terms of the tax credits. It was neither an advantage nor a disadvantage. And everyone we spoke to in terms of funding or the process were so supportive of what we were doing. I mean, housing is something that really resonates with people's hearts, and it's not difficult to get it. You drive around your city and you see what's going on. Don't have enough affordable housing and people are suffering. So that those reminders about the context in which we're operating historically and providing a legacy for people moving forward can really just be so profound. And I have a tendency to just be in the nitty gritty. You know, I execute. That's, I guess, I vision and I execute, but the housing gets so logistical. There was so much execution involved in financing it and getting it built that I appreciate so much these reminders of what's being contributed in all the iterations of the housing that we're talking about and all the people contributing to it. So that has really struck me today. I'm grateful to all of you.
Gretchen, want to go next?
Sure, sure. It's, I think, very similar to what Cece just said. I appreciate what resonates is our being reminded of the long arc of the moral universe, and our history together, and how we, every generation has been trying to answer some of the same questions in different ways, with our generations, each generation's wisdom and experience. So it's wonderful to be here, and be reminded of our long history and our accomplishments and terrible things that we have overcome in the past. And it's just lovely to be part of such a heartfelt, mission-driven and wise group of people. So I so appreciate the opportunity to be here, to learn about everyone's projects, to partner with you and cheer you on because of the great work that you're doing in your communities. And hope that we can continue to work together to really envision a different future and provide the future for our elders, our beloved elders, that they deserve, and that all of our elders deserve, and all of our members of our family deserve. So I appreciate the chance to be here today and be inspired by all of you. So thank you.
Thank you, Gretchen. Dr. Amani.
Ditto to what Cece and Gretchen have said, just to be in the room with you all, that I know that we share the same triumphs and challenges is just awesome. And I want to just end with this story about Harriet Tubman. Harriet Tubman did not really care who the president was when she got her freedom, nor did she worry about who the president was when she went back down time after time and freed other enslaved folks. The Underground Railroad, the Allies, they did not care who the president was either, as they helped free enslaved folks. And so in every oppressed people, we've been here before: Jewish people, gay people, women, we've been here before. And I just want to congratulate us and folks that are on the phone for our courage and our tenacity and our audacity of hope. that we know we're going to get through this. And Vinny, I just appreciate you and yourself of just moving forward with this, generation younger than mine. And you represent a lot of folks. I just appreciate you as well. And Caitlin, keep that research coming. Yeah, thanks.
Vinny.
Oh gosh, I feel so incredibly humbled and privileged to be among this gathering today. And there's this proverb that says, if you want to go fast, go alone, but if you want to go far, go together. And I can't think of a more uh, clear sort of call to action today that despite our geographical separation, we are connected and committed to um, our calling, which is to care and love for one another. And the wisdom within your community will propel you past the noise, the disinformation, the cruelty, and care is the antidote. And you have exactly what you need to make this happen. So Godspeed, and I can't wait to see how many more buildings and houses and homes are warmed by the passion of all of our community members who are committed to this work. So thank you so much.
Thank you, Vinny, and I hope you have a podcast soon because I'd love to tune in and listen to you every day. So thank you. Caitlin, you want to bring us home for this portion?
Well, it's like unfair completely to go after all of that kind of inspirational talk. But let me just say one quote that I really love because I'm a musical theater person. I don't know if anybody else on this call is a musical theater person, but there's a line in a Sondheim song called Wait, which is about kind of we're all just kind of trying to like focus on now as opposed to focus on the future. And the line says, now goes quickly. See, now it's past. And so I think it's about understanding that like now is important, but as Dr. Amani was just saying, like now is not necessarily what we're working towards. We're working towards that better future and that better collective future together. And so let's focus on designing that and not get too rightfully concerned about kind of what's happening now, because the collective action and power is going to ensure that we have a brighter, lighter, hopefully loving future. So thank you to the SAGE team in particular.
Thank
I
you
know,
all.
sorry, I just like I don't always expect everyone to love musical theater, Cece. I don't know, maybe not.
That's fair, but I do think it's fair to assume that there are some musical theater lovers on the call. That's all. Just had to have a little fun.
Well, again, I just want to thank each of you while you're on screen. For the audience that's with us, let's give them a big round of applause for joining us today and really just sharing of the stories, the successes, the struggles. We're all in this together to really make our world a better place. And I just really thank you all. So Dr. Amani, Gretchen, Cece, Vinny, Caitlin, thank you. And with that, I would like for us to welcome Priscilla Coe with the Harry and Jeanette Weinberg Foundation. I think we've all heard the Weinberg Foundation mentioned at least once, twice, I don't know, maybe 10 times today. So Priscilla, just really welcome you, to close us out today. And the Weinberg Foundation has meant so much to so many of our communities and would just love for you to bring us home.
Yeah, what an incredible testament and work of not only SAGE and the National Housing Initiative, but each of the partners and speakers today, and just a reflection over the last decade. As I reflect on what we've heard from our speakers and our panelists, and in light of the current political climate, I'm also struck at both the resilience and creativity of this community. We've heard and we've seen that despite antagonism, we've seen the desire for love and belonging always supersede and win. Despite we've seen external changing narratives, this community has always held on to its North Star and seeing the dignity of humanity. The National Housing Initiative is just a natural extension of that dual resilience and creativity. at a time where LGBTQ adults in our community were concerned about potential housing discrimination, what life might look like as they age out of their homes, and this strong desire to be in community and to be in belonging and to be its full authentic selves. We've seen that they've created the housing community that they've wanted to see, we've wanted to see, and all the creative aspects, whether it comes to financing, the yellow bricks, as we've heard, the artistic elements and design elements to really create not just a housing as a building structure, but really everything that makes it a home. And so the people that live in it and dwell in it, the design elements to make it as inclusive as possible and all these different things. Similar to other historical precedents, not only did this directly benefit the community and serve the LGBT community, but really extending beyond the lives outside its walls and really thinking about improving the lives of the surrounding neighbors and its neighborhood as well. Part of the reason of the foundation's support in the National Housing Initiative and so many of the projects that we talked about today was just to really be able to provide a central place of mutual learnings, of talking through different financing strategies, creative outlets, and exchange of ideas between community partners, nonprofit organizations, sister cities, and the like. I got to visit my hometown of Dallas, and Oaklawn Place was my first site visit when I came into Weinberg. And I've seen how it's transformed its block to link housing and medical and dental access. I got to see Sage and Stonewall earlier this year, and I was reminded again of the community's history, the fight for resilience, for equal rights and representation. And then over the summer, I got to see Gretchen and the Pride, and I got to see the full body of the community center, the nonprofits, the artists, gallery, the Regiment 54, and all of the history as a remnant of the school now turned housing and place of belonging. And every day I continue learning alongside my wonderful colleagues and partners who continue on this road of resilience and creativity. Just today, I learned about the Yellow Brick Road, Friends of Dorothy. I will keep that in mind. I was thinking about, I was watching The Wizard of Oz and The For Good, Wicked for Good coming up in the next couple of weeks for all the musical theater friends as well. And I just thought about this symbolic rainbow that we think about, right, with our community, and how this community continues to shine despite the rain clouds, continues to be a beacon of what could be, if only we allow ourselves to see it and participate and become it. So we thank you again for all of our panelists and speakers to spearhead this work. For all the audience members, we heard so much great dialogue and feedback in the comments and the Q&As, and just your continuous curiosity that continues to spur this passion and this drive. And lastly, thank you for Sage, for Cheryl, for Michael and your team to give us this time and space as we learn from each other. We're so privileged to partner with you and alongside each and every one of you. And thank you for your dedication and commitment as we enter in this to the shared hope and vision. Thanks.
Thank you so much, Priscilla. And we're going to get out of here a little bit early today, unless you all want to stay. No, I didn't hear anybody say I want to stay. So with that, I just want to thank everyone again. What an inspiring and energizing afternoon we've shared. I want to extend my deepest thanks to all of today's presenters, Michael Adams, Cece Cox, Vinnie Ng, Priscilla Coe, Caitlin McLean, Dr. Imani Woody, Gretchen Van Ness, and our ASL interpreters, and our captioner, Casey, Sam, Sebastian. You all did an amazing job. And of course, I need to thank my team, Jane Haskell, Keith Holt, Maddie Thompson, who was behind the scene, making sure that everything was running the way it was supposed to. We couldn't have done this without all of you. And on behalf of the National Impact and Engagement team at SAGE, we stand ready to support you. Please stay connected with us. And before you leave, take a few moments to complete the survey, where you'll have an opportunity to share about additional webinars and resources that we can help create for you as you continue in this journey. Thank you again for being a part of this movement, and let's keep building together. Have a wonderful rest of your day and be well. Thank you all.